I've bbeen in England for a while now, and I can categorically tell you that it is not Uhuru like everybody, some people will paint it like they are 100%. No, no. Even here, I can tell you that they have the personnel, thanks to people from Nigerians, especially from other parts of the world that come to assist and work here. But the fact is, even at that, most of the facilities in the UK, as we speak, have been overwhelmed. Sometimes, small fever here, you can be in the hospital for 5, 6, 8 hours just sitting. In Nigeria, people would have cried, Uhuru would have put it on social media.
The guy who called from Bedford, Matt, said otherwise. He said otherwise.
I don't know which part of England he is, but I'm telling you authoritatively, because it's also in the news here, that the NHS is overwhelmed. And that's the truth. That is not to say that when they want to treat you, they won't give you excellent treatment. But what I'm telling you, that even the wait time here right now, it's crazy, Kofi. You can check this online. It's all over the news.
Yeah,
and
of course, it's been the case for some time.
And I can also tell you that we have doctors in the US, in Canada, in the UK, that goes back home and come back here to help. Some of them based in Nigeria, but they are so good to the point that the people here always request for them to come. So it's not that the problem with Nigerian healthcare system is the corruption and the politician messing up the health system. There's nothing else. I'm telling you, Kofi.
So contrary to what Matt said, you're saying you can be kept waiting in the UK hospital. It's not just in Nigeria. They will keep you waiting, just like you were saying happens in Nigeria.
Friends who have waited in recent times 8-9 hours waiting to just see a doctor to tell you to treat you for flu. This is me talking. It's not like somebody saying.
I know of a case, I think somewhere in Canada, they have the same issue in Canada where their public the health is like the NHS. They said, I think someone said they had a case and they told them to go home and just and sleep to go because they were overwhelmed.
Do you know the reason why? Sometimes we try to paint ours as bad. We're so used to it. If you want to be objective, it's not everything that they painted that's excellent here, blah, 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 blah. No. This morning, I heard Sheriff and Uncle Jimmy talked about a hospital that has been awarded for construction bill 5 times they've paid, and the hospital is
Jerry, let's put Ade on the air. Ade, over to you. Thank you, Jerry. Stay with me, please.
Yeah.
Ade.
Good morning. Good morning. Am I audible?
Yes, you are.
Uncle JD, I used to watch your movies. Okay. I didn't even know you're the one. JD Alabi.
Oh, okay.
Sorry. Yeah.
Oh, that's the JD.
Yeah, exactly. He's an actor. Look at. Maybe he didn't want. Sorry. Maybe he didn't want people to know. I'm sorry. But I saw your DP. I realized. Yeah.
Okay,
Anyways,
I
think he has actually said most of what I wanted to say. To be honest, the previous caller who talked about mentality of the doctors change what they get. I mean, Look, it's not the doctors' fault in Nigeria that there are no ambulances in the hospitals. It's not the doctors' fault that there are no CT scans available. It's not the doctor's fault that there are no oxygen available in some hospitals. So which doctor would flourish in that kind of environment? So when you get over here where those things are available, obviously your work changes, your productivity increases as a doctor, you feel more fulfilled. But with that being said as well, it's not as if maybe the healthcare system here is 100% as well. Like we did talk about, waiting times here also can be crazy. Yeah. Because especially with the UK system, which is a national health service, it is technically free in inverted commas. So people go to the hospital a lot. People use healthcare services a lot for virtually almost everything. So at the moment now, but although when it comes to life-threatening injuries or life-threatening conditions, you'll be seeing faster.
Okay.
But and it is not okay.
Yeah, I want to ask you, Ade. Then I'll ask JD. Will you get on a plane and come to Nigeria to see a doctor for any reason, rather than use a hospital in the UK? Ade, you first.
So it depends on what it is. Okay, I have also advised patients to go to, for example, there's a patient who wanted to do a myomectomy, which is a fibroid surgery. Here in the NHS, the wait time is almost over a year.
Okay.
or 18 months self at the least where I am. But if you go to Lagos, if you go to some of these private hospitals, within a week you can get a fibroid surgery done. So in that case, because I work in the healthcare, so I'm a doctor here.
Okay. So
in that kind of case, I've advised some of my patients, like, look, if you can buy the ticket, go to Nigeria, Lagos to Abuja, you get this myomectomy, this fibroid surgery done. But here in the NHS, I'll have to keep you on the waiting list, because the same way you have this fibroid and all this sort of thing, there are 1,000 other patients who have the exact same thing.
Let's say there was no waiting list. If
there's no waiting list, no, there'll be no reason. Why not? The healthcare infrastructure here and Nigeria are light years apart. Okay, you can't even, like, in terms of infrastructure, it's light years, not even kilometers, or light years apart.
Galaxies.
You understand? Exactly. I can count the number of times I saw ECG machine in Nigeria, but here almost on every ward you see ECG machines lying everywhere. You understand? So they are light years apart. So if there's no waiting list or anything, there's no reason, absolutely no reason to go to Nigeria saying you're. To be honest, there's almost everything here.